We talk about type 1 friends when they get diagnosed with diabetes or insulin dependency. It's a critical time. Their family whole gets into depression. So that's where we train the family members. We train the individuals to monitor the sugar, taking the insulin, and that is handholded well.
Lately, we have seen like guests like Ram Kapoor or Kapil Sharma or Karan Johar, right? They did body transformation. They said the way they lost weight was everyone similar, like their cheeks and everything went in, right? Can you really tell if they are using Ozempic or not?
Why these type 1 children who at the time of detection or maybe at the time of exam or going through picnic, they require a medico-social communication support.
Right.
Why can't these medical students get trained for medico-social communication for type 1?
Right.
So we train them as a Sarthi. So who is Sarthi? Type 1 are labeled as Arjun. The trained medical background students or doctors labeled as Sarthi and Project Krishna established.
How do you manage stress?
So what basic I connect to stress is two aspects. Either capability, expectation. If both are matched, then it is eustress. If expectation is higher, capability is lower, then there is a stress. How we manage these, that is important. So there could be two aspects.
Can diabetes be reversed?
So
Firstly, very grateful and thank you for saying yes on such short notice. I should have seen you the first day and I should have asked you. That would have been like 2 weeks in the making, but very, very happy that you were able to make it. Let's talk about it on the entertainment side, okay? So lately, we have seen like guests like Ram Kapoor or Kapil Sharma or Karan Johar, right? They did body transformation. They said the way they lost weight was everyone similar, like their cheeks and everything went in, right? And I kind of talked to you about Ozempic, and everybody says that they're not under Ozempic. But I wanted to ask you, and when we were talking, you said that the guidelines have now changed with GLP-1 drug and all that, right? Can you really tell if
So,
they are using Ozempic or not?
GLP-1 therapy is all around for more than 20 plus years. So as a practitioners, as a consultant of diabetes as well as obesity, we had been managing the many friends with diabetes with GLP, that is incretin based therapy. And GLP is one of the hormone. Previously we were using twice a day therapy, then it came down once a day therapy. These were injectable. Then oral semaglutide came up in a further line ahead. And that semaglutide, along with there was once a week GLP therapy from another pharma company. All these were part of the work till I'll say 2018, 2019. Then oral also semaglutide came up in between. These were all going through. Now coming to the benefits of GLP is on insulin resistance as well as insulin production. So I'll say on pancreas it is alpha cells as well as beta cells somewhere around. But what benefit gained afterward with GLP was weight loss. And that's where it standardized for the obesity management with the brand name of Wegovy, Ozempic, or I'll say a different molecule, terzepatide, that is Monjaro. Now coming to part, these are the molecules which are now certified by FDA for the weight loss management also. The concern is what you see is at present awareness about Monjaro, Wegovy, Ozempic is just of upper layer.
Okay.
We use it for a longer duration for management of diabetes. Its added effects were the side effects previously were the decreased
Hunger
appetite, hunger suppression, satiety influence. So you get satisfied with a minimal food, and that was leading to weight loss, ultimately increasing the basal metabolic rate and decreasing the weight and increasing the metabolism.
Okay.
But now that has been also taken to the benefited way,
Right.
due to our weight gain or overweight or obesity, a major chronic concern at present throughout the world, and
Right.
that's had been influenced by this medication in a better way.
Got it.
Yes.
Okay. So, but when doctors prescribe you now, they said that injectables are quicker results, better once a week versus the oral.
So what is the difference? These GLPs are peptides. Usually when we take it orally, they get digested through digestive tract. Only one molecule, one company had practiced the innovation in a way that oral tablet of semaglutide GLP is well taken care through digestive tract and now have been upgraded and FDA approved as a Wegovy also semaglutide oral that is well tolerated through GI tracts.
Got it.
But injectables, yes, right on bank. Previously, when we were using twice a day, good effect on diabetes. Once a day, good effect on diabetes. Once a week, good effect on diabetes. Once a week, these newer molecules had good effect on diabetes, obesity, metabolic management in a great extent.
Awesome.
And that's an upgradation of molecule. Even upcoming research and molecules are in a line that these molecules would further upgrade ourselves for a better metabolisms.
Got it. So we did a research and we made a video on Ozempic, and in our research one of the topics was that effects, what happens when you stop taking Ozempic or GLP-1, right? Because diabetes, let's say we're going to dive into it a little bit more detail down the line, but just right now for my sake of and closing this chapter, is it once you stop taking, what happens?
So that's a perfect thing. When we talk about molecule in healthcare, the marketing or the media is focused on molecule. But if we talk about individuals, so the first perspective for ourselves is individuals' health. If we talk about any celebrities, they talk about it is not Ozempic or it is Ozempic or it is not Monjo, I'm on Monjo. These all are side products. But why they got those things, it is much more important. So it's an individual health.
Okay.
Individual health, why it matters? It is mental well-being, physical, social.
Right.
That's where we need to focus. And when we lose weight, that helps a lot on cardiac health,
Okay.
muscle health, mental health, even social health also.
Right.
They
Your mood uplifts.
uplifts. So
Right.
ultimately, all way around, what were the indications for these molecules to be used by these individuals is much more important.
Right.
If they are motivated well, then it is not only molecule. The other parameters, physical activity, diet, stress management, sleep management,
Right.
habits, or I'll say the drugs or the addictions management,
Right.
those also taken care well.
Right.
Then maintaining this molecule and then off going through this molecule is much more important.
Got it.
And that's where we get benefit more after even stopping this molecule because they have adopted the better lifestyle.
So is it prolonged benefits after you stop? You can, as long as you have a lifestyle change, you can sustain that same health. You are saying.
This is wonderful. So there are hormones, ghrelin, as well as digestive hormones, GLPs, GIPs, all around. When we go through the metabolism, when there is a sustainable use of these medications and lifestyle, then over a time it adapts to the newer and internal environment,
Right.
which adapts this for a longer duration.
Got it.
If we talk about short duration, maybe 1 month to 3 months usage, that's a different scenario. Even we have used in our patients or friends with diabetes for 20 years and they are doing well.
Okay. Wow.
Without complications, and these are where educated, learned, evidence-based believers, doctors,
Right.
oncosurgeons, all around.
Right.
And they have used it very well and using till time, upgrading the molecules and other things. Now, if we talk about for sustainability, what research data shows is if we use it for 5 years, the results are tremendous. But we add on the lifestyle and we wean off over a time by 2 years to 3 years to 7 years, the sustainability is well maintained with adaptivity of lifestyle. That includes obviously healthy green eating. Then we talk about physical activity, so moving ourselves all joints as well as in better part of the day. Then sleep patterns, so maintaining circadian rhythm and sleep pattern, managing. So in India we have tobacco or smoke or alcohol,
Right.
that to be managed, or throughout the globe managing those substances, and then obviously the mental health in a great extent that supports a well.
Right.
Even I would pray certain level sunshine or maintaining your physical activity in sunrise to sunset part.
Right.
That is also helping the circadian rhythm well to adapt to these all changes.
Got it. I'm going to say something not, I don't want to, I'm just going to say it. It might be controversial, okay? But, okay, because you're the doctor, you're a specialist, I have to ask someone like you. Let's say science has progressed so much in these years. We have been able to detect so many different types of cancers, diseases, just because science has progressed so much, right? Why has no pharmaceutical company ever been able to produce a drug that solves the diabetes or reverses it completely?
So this is a fundamental thing, physiology of individual. So when we talk about diabetes, there is not always insulin secretion deficiency. There is also insulin resistance also affecting simultaneously. So what insulin does is metabolizing the glucose and making sure the euglycemia is maintained. The range of 70 to 140, all sugars or in millimoles, it maintains in the range throughout the 24 hours. Now, when we talk about diabetes, the molecules which we have available is either acting on insulin resistance or either acting on insulin secretions. The defect is the real beta mass where insulin is produced, or insulin resistance where insulin is not getting the best outcome of it, whatever
It's
insulin
resisting.
is secreted, resistance. In that level, the resistance is decreased, then we have less requirement of insulin to work for, and that works well.
Right.
When we talk about cure, 100% cure or without molecule, then it goes to the individuals. We have 30% of our patients without any pills and maintaining euglycemia. That's because their diet, physical activity, stress, weight, and circadian rhythm, all substances are managed well.
Are these pre-diabetic or are they diabetic?
Both. Even they had been on insulin and weaned off over a time. But that's where we need to manage the need of their daily consumptions and metabolism.
So one second. So they were on insulin. They were taking insulin, right? They were taking injectables, and you were saying that you stopped them and then
That's true. So it's a progressive.
Okay, so it
progressive.
can
They
have a
adopted
reversal
it.
effects
Yeah.
as well.
So certain time they talk about relapse of diabetes or reversal of diabetes or remission of diabetes. So it is all on how they adapt to the insulin resistance
okay,
and how they adapt to their lifestyle in an extent that over a time their requirement of external usage of drugs is minimized and their own production is matching up, insulin production is
Right.
matching up the needs.
Got
And
it.
that's where it is balanced. They are told diabetic, not they are not just without medicines.
Got
They
it.
are diabetic, well controlled, without medication.
got it. So that's the difference. If
That's
you're
the
diabetic, not necessarily you will be. So it's important to understand the resistance versus the secretion
Secretions, yes.
of
Insulin.
and that controls it.
So
okay.
now coming to the research, when we talk about this is type 2 diabetes, now coming to type 1 diabetes, and there are many types of diabetes. But when we talk about insulin dependent diabetes, where purely insulin requirement is there, this where the beta cell production, beta cell mass producing insulin is minimal or getting, I'll say, autoimmunized by our antibodies to destruct that. But that is type 1 insulin dependent diabetes. In those individuals, even the cure has been FDA approved in a name of Lentidra. It's a brand name, Lentidra, but it's a University of Chicago protocol
Okay.
where cadaveric cadaver, so dead individuals, pancreas is isolated from their islet cell is isolated, refined, polished, and sterilized, and then they are incubated, cultured, and then transplant to the needed individuals who are matching up the protocol. So it's a transplantation of cadaveric islet cells to the individuals who require insulin in great extent and they have plenty of complications.
Okay.
This protocol got succeeded and it has a good success rate.
This is for type 1 diabetes.
Ideally, type 1 diabetes, not to the mature to type 2 or using to other type 1 who are stable. Yes, previous protocol was Edmond protocol where I have also worked on, but this has a good success rate. And
Okay.
that's where I will say one of the cure is possible. When we evolve over a time of, I'll say, discovery or innovations or research, then there is a scope of cure also in future. But in healthcare, what we need to believe is it is not that any innovation and right straight away to be used into the human being because it has a safety concern.
Right.
Previously, we know that there were a few mobile phones when we put it in charger, they were blasting.
Yes.
But they were taken back from the production
recall.
house, recalled. Yeah.
Yes.
So that's why. But in this, if anything is administered, we can't recall it back.
Right.
And that's why the safety measures and then research and their data and observation, and then it could be utilized.
Okay.
And that's why certain time this escalation could be done faster way.
Right.
But it is I believe I'm putting the finger cross.
That something positive comes out.
That could be, and that's where we are working all around.
Right. Exactly. So let's talk about another very important topic. So topic of diabetes is personal to me, okay? Because I lost somebody, I lost couple of people to diabetes, right? And this is a very personal topic. So And in kids, it's like it's beyond crazy because kids, first of all, their parents try their best, but I want you to tell the sugary drinks like the sodas or like the Red Bull or any kind of sugary drinks, right? What does that do to a human body?
The kids are the one who learn from their superhero or superwoman. And who are they? They are parents.
Yes.
You got it? And their incubation of this all metabolic condition is from their 9 months of pregnancy to first 12 years of age, where they adopt plenty of things by seeing their parents more rather than listening from them.
Okay.
Do you get it? So we learn from, I'll say, watching them what they
Right.
do it,
Right.
and that's where we the children adapt the behavior on in
Right.
that line. Now, another aspect to add on, if we see the global part and the business industries, food industries around, I'll say what is good, either milk, buttermilk, or yogurt or curd, or is it the aerated drinks or the alcohol?
Right.
So if we ask anyone, they will say obviously
Dairy.
the products which are natural to us, they are good for our health. But who gets better marketing?
Obviously, the
Obviously other
yeah.
part. So that's where, and what influences the other? Who are the celebrities endorsing all around?
Right.
So that's where the superhero, superwoman already gets attached to this part of the, then why not the kids?
Right.
And the children get more exposure to such behavior and they adapt well.
Right.
If we see how we adapt the technology is much more better way than our parents,
Right.
then always the adaptation is much more higher in children, and that's where the influence of this happens all around. We don't want to discuss the brand rather than, but it is all how they are created,
Right.
what are their I'll say the water which we use and the water they use, it's a different phenomena, and
Right.
they're fluid.
Right.
So we need to take a stance and we need to believe that if we demonstrate well, then our children will adapt well.
So I have 2-year-old younger son, right? And let's talk about. I want to also ask you, because your WhatsApp University, Instagram University says that first 2 years of your child, if you don't give them sugar, it has shown to have much more positive impacts when they grow older.
That's true.
Dr.
That's
Yash, is that true?
I would say that's true, because sugar is one of the simple carbohydrate. If anything is required in a nutrition is carbohydrate, protein, fat, and then micronutrients all around. How we balance their diet is much more important. And talking to first 2 years of life, they are always initial part breastfed in our community, and
Right.
where breastfeeding the milk contains the better source of carbohydrate, protein,
Right.
and all required fat concentration.
Right.
Then coming from breastfeeding to weaning off, usually in our culture we were using a part of jaggery,
Right.
a pure
God.
ghee, gourd. So that's where, and those are the things which gives them iron, the muscle mass,
Right.
and protein all
Right.
around. And that's where they start growing well, developing the brain well, developing their muscle well, their sight well,
Right.
the eyesights and other things. And that's where we should insist on to go to our roots rather than to go to the other part.
So
and
basically,
we're
go to
coming,
natural versus of artificial.
so what I usually advocate about is for ourselves to adopt also, and to children also, but children follow our behavior. It is better to go for a product which is homemade rather than factory made, and to the product which is farm based or forest based rather than homemade. So I'll give you an example. Rather than sugar, it is jaggery. Rather than jaggery, it is I'll say dates or apricots or kismis, anything.
Right.
Because how much refined, how much natural, that gives a different fundamentals. Same way, rather than toast breads or muffins, it is better to have our homemade rotis, theplas and rotlas.
Right.
Do you get it? And or khakra.
Right.
And then to the much more side, milk or fruit. So these are carbohydrate only.
Yes.
But how simple and how complex carbohydrate is served to us, that makes our digestion as well as metabolism in a much more better way.
Got it. Also, you yourself just said like few minutes ago that your lifestyle plays a big role when it comes to like managing your diabetes and insulin sensitivity, right? And you have heard about the studies which are now saying that you don't need to do like 10,000 steps a day. You are okay with 7,000. After that, from there on to 10, it's an appreciation, but it's much lesser.
That's true.
And then beyond 10,000, it's not as significant as you get from 1 to 7.
So it is like individualization of any lifestyle management is much more important, or lifestyle adaptation is much more important. So talking to exercise, diet. So usually in our practice, what I much more focus is the timing for the same. So let's talk about our body starts kicking off metabolism near to sunrise, hormones, enzymes all around, and to the sunset it slow downs. So like in our families and all around, they were used to wake up before sunrise,
Right.
and they do their daily activities as well as spiritual activity near to sunrise. They do their whole breakfast just around the sunrise, and they do their whole day activity throughout the day till sunset. And before sunset or near to sunset, they were used to complete their dinner.
Right.
And that could be in Indian time, we say around 5:30 to 7 was the probable dinner time for our forefathers,
Right.
maybe grandfather's grandfather or grandfather too. And then thereafter, they were used to sit along, talk about their daily activity and de-stress themselves. And then there would be a few folk songs or the bhajans or kirtans, and that would be a spiritual activity. And they sleep off by 9 p.m.
Right.
And that was the lifestyle of ourselves. Now, what had happened? The exercise part before sunrise or any part before meal has a good influence. After meal, keep it to the reserve as a sub activity.
Okay.
Same food near to sunrise to lunch time to dinner time. It should be like breakfast like king, 6 items, 5 items.
Right.
Lunch like twin, 3 items, 4 items. Dinner like beggar, 2 items, 3 items. We were used to take khichdi milk at the end or khichdi curd in the end. Lunch there could be roti, sabji,
Right.
roti, veggies, dal and rice. And in breakfast we were used to have plenty of servings from jaggery items to all around.
Right.
So laddu to all around.
Everything. Right.
And that was our matching to our metabolism. Why our forefather had a good structure, good stamina, life longevity much better way, that they were matching up the circadian rhythm throughout the day.
Okay.
And that's
Right.
where we should insist ourselves to get connected to that lifestyle.
Right.
And that's where when we talk about anything, good food, taken high calorie, good fibrous food, taken at the end of the day is just waste for us. If we take it with breakfast, that is real, I'll say, energy source for us.
Right.
Same way, exercise or physical activity taken in the during the daytime, early part of the day, gets you to the much more stamina, muscle mass better way, rather
Okay.
than the end of the day
Right.
or before sleeping.
Got it.
And that's where our all mechanisms work around.
Got it. Let's talk about work culture. Working class people, when they go from 9 to 5 or 9 to 8, they work. And here we're talking about adjusting our body to circadian calendar. And you said before from 5:30 to 7, I eat at 5:30 or 6. But before 6, I'm usually done when I'm in US, right? Here, obviously, I cannot, I try my best, but I'm not able to do that. But how can they are the most who are
Vulnerable.
vulnerable and prone to sedentary lifestyle.
That's true. That's true.
Can you share like some tips
So,
for such individuals?
Let's go to one of the data. Why I'm giving you the background. I would share, this is an open question to all around.
Yeah.
So if we see the most developed part of the world or most productive part of the world, their working hours per week is limited to maybe 35 to 40 hours a week.
Right.
Germany, you get it? Any part of the world. When we see even institutions, business companies, where we see the most productive people are working minimal hours and they are focused too.
Right.
Same way, when we talk about the productivity of an individuals in the company, either they are shift of 9 to 5 or maybe shift of 12 to 8 or in a shift of maybe evening to overnight. The willingness of themselves to maintain their circadian rhythm makes a major role. I'll share what we do in our clinical practices.
Please.
So usually the 9 to 5 are the one based who have time for early breakfast, lunch at the site, they carry their tiffin and have it, and dinner with their family members. This is the base case scenario, and where we need to enter in minimal.
Right.
Now coming to the 12 to 9 shift or 12 to 8 shift, where the family needs to step up further way ahead. Breakfast good time, good quality time in the morning, and then lunch done before they depart. The tiffin filled for the dinner is with themselves, or maybe we need to do with a porter or anything, or dropping the tiffins by family member to their working site, or maybe the institution. There are few institutions which provide dinner also to them, and that to be completed before or near sunrise, rather than they go home by 9 to 10 p.m. and have it and then sleep later, longer hours, so take on longer. So it's better that they do it early, and that could be in India we have now porter services or Swiggy, Zomato, they deliver the stuff to them.
Right.
That's possible.
Right.
Now we talk about the evening shifts to night shift. So they can maintain the circadian rhythm in daytime. In evening they can carry their tiffins for the dinner, and
Right.
overnight they munch themselves with I'll say the quality food which can support them for their working,
Right.
and come down home, have fruit or doodh, and then they can go for a sleep. So they can sleep also early. Any shift going home and taking dinner later than 8 p.m. 9 p.m., that delays their sleep initiation,
Right.
like that delays their social activity.
Right.
It's better they complete early and they socialize with their family, and
Right.
then do the further things, and they can sleep early.
Right. Two follow-up questions on the same topic, right? So there is a lot of research done now where it's showing that the youngsters are getting much more diabetic than the older population. And my question on that was, is it because of more screenings that we are detecting them now versus the older days, or is it actually a trend
So
that's
I'll
causing
give you the
this?
data on that background. So what we see, so we had been practicing for 40 years in this field. This is our 41st year going through now. What we see and what research shows, if either or parent is type 2 diabetic, then next generation chance to get it is 50 to 70%. These are chances. Second, if both parents are diabetic, then there is a 70 to 90% chances to get it into next generation. If the next generation in number is four siblings, then what could be 50 to 70 mane 2 to 3 will get it, or 70 to 90 mane 3 to 4 will get it in their lifetime.
Right.
And these are the chances. The concern is what we see now is 10 years earlier than their parents' detection, they get it. At least 10 years prior. So if their parents were like in the age of 55 and 60 got detected, they are in the 45 or 50, they get it, the detection of type 2 diabetes.
Right.
So what kind of clinical scenario we usually face around is, there are a few friends who come down and ask me, sir, in my family there were no any member with diabetes and I got it in my early age. And there are another question, clinical question we face around is, sir, in my family, my father, grandfather both had diabetes. In my maternal family, my nanu, my mamu, and my mother all have diabetes. Then what could I do to prevent my diabetes?
Right.
So that's where the real scenario is. Early detection is one of the awareness aspect, and that is real, that it is beneficiary for health. But what we miss out is diet, physical activity, stress, weight, and habits, and that to the sleep. So these are the primary pillars of health, and their timing as well as activity, the intensity of that activity is much more important.
Got it.
And that's where we primarily talked about, if these pillars are well fitted, then the building of metabolic disease is just pillars.
Right.
If they are wobbling around, then whole building of metabolic disease built around. And that is not only obesity or diabetes. It is one of their representation.
Right.
So it starts with belly fat, regurgitation, acidity, constipation, burping, path, all one. Then snoring, early cataract, thyroid, joint pains, osteoarthritis, osteoporosis, then diabetes, vitamin deficiency, obesity, dyslipidemia, all are one beads of mala. एक आया दूसरे लेके आया, एक आया दूसरे लेके आया. And that's where the sequence goes on. Not to that level. Even fatty liver, gallbladder stone, recurrent infections, PCODs in female, menstrual cycle disturbances, hair loss, all in that line. One by one, one by one, one by one.
Right.
If we don't stop over there, then there are further sequence: neuropathies, retinopathies, nephropathies, stroke, cardiovascular disease,
Right.
all cardiac abnormalities, all in that line.
Right.
Susceptibility to infections. So we need to work on the primary sources, the pillars and the belly fat.
Got it.
And that's where we need to work on better part.
Got it. So I have seen you a couple of times, and you talked about stress, right? And what doctors normally, when you get some disease or something, right? Even my primary care there, he tells me, like, stress mat le, yaar. They don't take stress, They say that, but it's very
How
difficult to
to make
not
it?
take stress, right? And how do you manage stress?
So I manage in a plenty of different way, but what basic I connect to stress is two aspect. Where could be the stress possible? Either capability or either the expectation. If both are matched, then it is use stress. If or manageable. If expectation is higher, capability is lower, or the resources are lower, or the shortage is there, then there is a stress. How we manage these and we manage in a use stress level, that is important. So there could be two aspects. Either we increase the capability or either we say decrease the expectation.
Right.
And that's where we manage the stress around. And that is the use stress management.
Okay.
To use stress those things, that influences how mentally strong we could be around or how capability we can build on. If we talk about the people in state of Gujarat, talk about is their 10th result, 12th result. My son is studying and he is performing for 10th. If the expectation is 90, his caliber is 70, then how that expectation is reduced and the capability of performing well is improved, that makes the use stress.
Right.
And that's where we can work on to manage the stress. Now coming to your health, if primary care is asking not to take stress, then we need to ask that what expectation should I reduce on my health, and how you are coping up with my capability to make up those expectations. That's need to ideally talked about. But that is not taken, just influence is taken care. He build up your capability with medications, and over a time you decrease your expectation. Yes, I have got my things, or you match up the expectation. That's how stress we manage around.
Okay. But that has implications on diabetes as well, right?
Same.
That triggers, correct?
So if I see data, globally, the depression is almost 22 to 26% present in case of diabetes. If we talk about insulin dependent diabetes, the number is much more higher.
Wow.
And these are real depressions.
Right.
And somewhere they have depression about taking pills, social stigma about declaring their diabetes, social stigma about taking the insulin. Even they have different stigmas related to those depression, just feeding the depressions around. Maybe their lifestyle not matching up. So that's where we need to just make sure aware about that they are friends with diabetes or obesity. They are not the patients. They have it. It is not the condition have it. So individual has diabetes or obesity. It is not, or overweight. It is not that diabetes is having it. So we need to make sure how communication is taken care to them. We talk about type 1 friends when they get diagnosed with diabetes or insulin dependency. It's a critical time. Their family whole gets into depression. So that's where we train the family members. We train the individuals to monitor the sugar, taking the insulin, and that is handholded well. If that is taken care well, then the ground level is on something different level. If not, then the psychology level varies in a different level. So that's to be taken care as a whole family, as a whole society. Usually कोई बोलता है, in Indian scenario someone asks कि oh, that's the reaction where the psychology starts. Rather than oh, it's okay. It is happening around. Now we need to take responsibility. If that reaction is around, then that makes a vast difference.
Yes. People do have the tendency. I'll tell you a funny story. This is something just on a lighter note, right? Tetanus injection, right?
Yes.
You take it 10 years apart.
5 years, 10 years, and then apart whenever needed.
I have a friend. He is supposed to be my stress buster, but he always gives me stress. So I took a tetanus injection 3 years ago, okay? He convinced me I got a cut. He convinced me this is bad. And I went again, and tetanus injection goes a little bit deeper.
Intramuscular,
right? So
yes.
I took it 3 years, within the 3 years range, I took it again.
Yes.
And he always, if I have any pain, he's like, no, you need to go and see doctor right away, immediately. And I had a back pain, and I had to do ultrasound and everything. And my doctors insisted there is no problem. I was like, no, I think there is some problem to check. So I have people like that in my life who are supposed to be my stress busters, but they are the ones who give me the highest stress.
So
but I have now learned to work around them. You
So
know,
that's the ideal thing. I would share same note on my side. So same happens to us, and if I talk something, I'll be giving you one evidence also in it. Globally, Harvard had research. The most compliant patients are doctor. You got it. So, and they are the one who don't comply with medications or the advice maximally as a professional. Barabar? Now coming to second part, same stress busters to stress reliever. There are certain occasions where my wife is so wonderful that she has relieved my stress to the great extent.
right?
But she is the one who supports to the increasing the stress at a certain level. In a way, when I get cough, I think of let my body heal by itself,
You don't want to
or
rely on medication.
I'll maintain my circadian good nutrition and the
Yeah.
one around. She's worried why you don't take pill. You advise everyone why you don't take pill. So
Right.
that's where we need to balance.
There are two spectrum of people, right? Some will not do it till the extremes, like, and then some they will be like, even if you cough or sneeze, you have to go and
So in
see the
this
doctor.
system, what another paper in Harvard, they have mentioned 93% of our outdoor patients visits are always accompanied by their patient's relative or friend, and that's where we can develop the ecosystem of empowerment. It is certain time we go to the doctor, but we miss out certain questions to ask them.
Right.
So it's better that our family members are or the accompanying person or category is already talked about this. We need to ask to the consultant. A way around certain time consultant explains something and we miss out. Then when there is a accompanying person, they can grasp also and support us to implement also.
Right.
That's where the empowerment works around. And we always insist to our setups, always accompany your caretaker or cooking lady. Because I tell you to take care of your oil, salt, and other things. How much you tell it to your cooking lady or how much she listens to you, that is a different question.
Yeah, right.
So that's where we always insist that the patient should be accompanied with their cooking lady or anyone.
Doctors are also like different. They're like extremes. Some, like you said, you sneeze, you get three different types of same cold medicine. Some will say, resist, fight the urge. You don't need to get on medication right now. So it's striking balance, right?
That's right. That's right.
So let's. So I'm in Gujarat right now, and I have pulled out 5 to 6 to 7 amazing people, including yourself, right? You work with government of Gujarat to educate and enlighten people about diabetes and obesity, right? Can you talk us a little bit about
So
what you do with that?
in India, we have bigger geography. If we talk about Gujarat also, here it is said every 5 village to 15 village, the language changes.
Correct.
In a way, in Gujarat also, there are plenty of different avenues to work for. In especially if I talk about diabetes also, we have adopted 3 districts of Gujarat at present also for last 22 years, and to implement the diabetes system to whole districts around, from primary care to village level to secondary care to tertiary care, for insulin dependent also, to the mothers or I'll say the pregnant woman going through for the screening of diabetes, or if they have the sugar or detected during pregnancy, to manage for them also, and the type 2 diabetes which is right rampant present into Gujarat. So type 2 diabetes is one of the epicenter, or I'll say epidemics in Gujarat. Now in these 3 districts we had different I'll say the barriers or the concerns to work on. There is one part of the district where good instruments are implemented, training of staffs is also we have taken care, but there were less footfall because the community was not trusting the primary governmental setup over there. So there were no footfall for detections, or I'll say blood screenings, no footfall for doctor's visit, and they were managing by themselves. And that's where we collaborated with local NGO and we did street bhavai, street drama, to
Okay.
encourage the or awareness about diabetes, what presents in equipments or the quality they have at their ground level, village level, and then that increase the footfall in that area.
Okay.
We had another concern in different part of the Gujarat where the mobility was concerned. and to deliver the things were concerned. So we collaborated with the vaccine institutions, and as vaccine was delivered, same way the insulin as well as the medications were delivered.
Right.
Another part of Gujarat where there were doctors, they had great, I'll say, dropout ratio, or else they were not maintaining their job for a longer duration.
Right.
So we train them, and then they get off from the Gujarat, I'll say, the government payroll, and they maintain their private practices.
Right.
So at that time also we empowered the sisters and nursing to take care of primary care,
Right.
and then to report us to the telecommunication. All three districts had a primary care, secondary care, tertiary care. And if tertiary care had a trouble, then we were doing at the time, 2008, we established the Skype model. At the time, Skype was the call available,
Big,
phone
yes.
available. And at that time, we established the Skype infrastructure, and we did conferencing call to all complicated cases.
Got it.
This was the one aspect of these three districts. Then Gujarat government took the audit of these three districts and our projects. They built up this model replication to other districts of Gujarat.
Okay.
Then they increased the funding for other districts of Gujarat to non-communicable diseases, then specifically to diabetes and all way around. How we did it, the international organization also started observing, and they wanted to deliver the hepatitis care to these districts. So they adopted to our channel. They go through, and during the pregnancy, they need the screening of hepatitis as well as, if positive, then hepatitis vaccine. They adopted our system. In such
Got
a
it.
way, mutual understanding, and as Hindi saying is there, if we want to work, then world will support us to work. And
Right.
from where we get support, we don't know.
Right.
Same way, this is not only to that level. The type 1 children, we have Make My Life project for them. We train them for insulin therapies, empower them, counsel, separate OPD for them, all around, family care, all. Then over a time, we adopted different hospitals type 1 setups to adopt the type 1, providing insulin free of cost to them or
Right.
subsidizing them. Then over a time, these type 1 children, now government is also supporting to insulin therapies to them.
Right.
We adapted the technologies for them, continuous glucose monitoring system, insulin pump, getting donors to fund them. And that's where all we're going through. One way around in our education program, there were post MBBS, post primary graduation of doctor. There were students who have been associated with us, and they were doing only for blood camping, blood donation camp, and other screening camps and other. They had urged for us, okay, sir, if you want to do a longer duration project where we sense the value of it, why you can't create a project or involve us to the same level? And that's where I clicked. Why these type 1 children who at the time of detection or maybe at the time of exam or going through picnic, they require a medico-social communication support. Then
Right.
why can't these medical students get trained for medico-social communication for type 1?
Right.
So we trained them as a Sarthi. So who is Sarthi? Sarthi are the one who, like Krishna in a Yuddha of Mahabharata, how he empowered Arjun. So type 1 are labeled as Arjun. The trained medical background students or doctors labeled as Sarthi, and Project Krishna established. So these people are trained for medico-social communication for specifically at the time of diagnosis, how to counsel the family members, how to counsel and teachers, how to counsel the type 1 friend, then budding with them for when sugar decreases, what to manage for hypoglycemia, how to manage for hypoglycemia. Then when they want to go for exam, to take exam, then what to do for. When these children want to travel abroad for studying, then what to manage. If they the young girls are getting into the puberty, at that time how to support. When their menstrual starts kicking, then how to support them.
Right.
Same way, if they want to go for picnic, travel, how to do it, how to monitor for sugar. These were the social communication they were trained. And they were budding with type 1 friends. And this Arjuna Sarthi combination, we took it for 3 months, 1 year, and that helped us to reduce the hypoglycemia incidence in type 1.
Right.
Preventing diabetic ketoacidosis, one of the complications for type 1 friends, in those individuals, preventing hospitalization for these children, getting better their A1C. These were the outcomes achieved, and this is like co-work.
Right.
It's a community work. What we had been instrument training them for medical social communication and adopting these children to support them.
Right.
There were even reverse mechanisms helped us. These doctors were visiting their home and empathizing themselves for type 1 care. So till medical graduation, they were not told about or trained about how to get empathize. And that was
Right.
benefited and their professor reported to us.
Right.
So this was the outcome on their side.
Right.
Our way institutional way, how we benefited. The type 1 friend whom we have adopted for 100% insulin subsidization. They don't require such subsidization. So they ask, sir, you can do 1/4 of the subsidization. You can do half of the subsidization. The rest could be taken care to other individuals. So
Right.
such a way, whole ecosystem worked as a
Right.
project Krishna. So
Got it.
Krishnas are the one who are trained as a Sarthi and support to the Arjunas.
Wonderful. I think this episode is going to be a very, very important on this point right now. Can diabetes be reversed?
So reversal, I'll say, is one of the question which always ask about. If individual works, there is a possibility of managing diabetes, getting into the euglycemia without medications or insulin. And that is possible when our requirement of insulin is matching up our production of insulin.
Got it.
And that's where how we adapt diet, physical activity, stress, weight, habits, lifestyle, sleep, all around.
Okay. So we can, simply say this, we can not necessarily reverse it, but we can live with diabetes without any medication,
That's true.
provided those 5 or 6 pointers that you said, they align.
They are aligned.
That's the right way of looking at it.
And that's where I give another example to make sure that you maintain without medicine. It's like driving a car at 60 miles per hour. If you are driving a car at 60 miles of hour and you don't see the speedometer, then how would you be confident that you are driving on 60 miles of hour?
Right.
So it's better you are in euglycemia or normal range. How would you get it? If I type it, I won't understand what sugar of mine is at present.
Right.
It is just monitoring yourself either from glucometer, either from CGMS, either from intravenous blood. If you continuously monitor your sugar, then only you will understand that you are in the range.
Right.
Otherwise, we won't understand that it is in the range.
Right.
And without medicines or with medicine, the control is much more important. It is not for today or 3 days or 3 months.
Right.
It is lifetime process. If you want to maintain yourself without medicine throughout the life, then it's a continuous vigilance, or I will say monitoring.
Right.
That is much more important that you are in the range.
Got it. Where do you see the diabetes care in the next, let's say, 10 years in Gujarat?
I'll say retrospectively, 40 years back when my father started, the diabetes was getting screened or detected by tasting the urine. So they were used to taste the urine and say the individual who peed, their pee was tasted by themselves and it is sugary. And from there, the innovations had come down to this level that screening, CGMS and all is workable to us.
Right.
Now adding to the further line ahead in 10 years, I see real drastic transformation in this field. That's from primary care to secondary care to tertiary care. Till time, we have one amputation throughout the globe in every 20 seconds. So probably we have talked for almost 55 minutes. Till time, it is around 165 limb amputation throughout the world. So that's for at present scenario throughout the world, not into the Gujarat. I am talking about throughout the world. And out of these all amputation, 99% of amputations are preventable. This is one of the complications. What happens to retina? What happens to CV stroke, heart attack, paralysis, dialysis? These all could be preventable with the right awareness and appropriate management for the individuals.
Got it.
And it is preventable. If we work on the technology as well as ecosystem, the technology is evaluating well. How those technologies merge together and create ecosystem is much more important. And I'm really looking forward. We have now watches to mobiles where our real-time data are shared.
Right.
And if we maintain the confidentiality of it and create a whole ecosystem,
Right.
that could be a good step for not only diabetes or obesity or weight management,
Right.
even to stress management, to any part of the health, that could be an asset. And we really should work on it.
With AI advancement, with a lot of AI, your research time can be shrunk
That's true.
by big margin. At the same time, you can get a lot of statistics, analytics, visually data available for you, right, to make the prediction, make calls, right? How do you see this will play a role to speed up the solution of diabetes? Where do you see this?
So obviously AI has drastically made differences to all field. AI in screening, AI in early detections, AI in monitoring, AI in trend presuming. This is where when there is a diagnosis part is involved or management is part involved, could be supportive. Even AI in detection of retinal defects, AI in complication prevention is part of it, and that could be worked well, and appropriate time that would build well. The base thing AI could work is in the research field. What could be the preventive medications we can use for? What could be the, I'll say, insulin resistant medication upcoming time could be adaptive to? What could be the obesity chances and their complications? Prevention medication could be available in further line, and that could shorten our research span for any identified molecule, and even to identify such molecule also the AI could work on.
Right.
And there is vast scope. Still,
Right.
the area is raw, but that could have a good scope of building the research in a shorter span.
Got it.
And that's where the technology comes to, or healthcare technologies comes to us easily if AI starts working well
Got it.
in that line.
Right. And Dr. Yash, my final question for this session, right? What do you want every home in Gujarat or in India to know about diabetes? Because something that people should know
So
and be aware.
in Gujarat, every home, I would say what data has is every 4 adult, one has diabetes. So every home, one has diabetes. And the message I would pass on to is, yes, diabetes is preventable. 100% preventable. Though you have strong history of diabetes, you can prevent it. And diabetes prevention is the individual's job.
Amazing. But thank you so much, Dr. Yash, for doing this for us and for the audience. This is very important topic and that came at the right time. So very grateful that you were able to make it and, spread your knowledge. And for the audience, if you guys like the episode, please like, share, and subscribe. And please write in the comments some of the revelations that you had that you did not know. Some of the things I did not know, but I learned for the first time. So this is our host signing off. I'm Halak. You just watched this episode on the Halak Show. I'll see you guys next week.